Good evening, I'm Dr. Akl. I am a cancer specialist in Flint. Today's topic will be what patients should do when they know they have cancer. Today, cancer is common. Most common cause of cancer is the use of smoking and drinking alcohol. By stopping smoking and drinking, about a third to half of cancers could be prevented. Symptoms of cancer could be pain, bleeding, new mass, new lesion, significant weight loss, cough, and so on. So cancer symptoms could be non-specific, and these symptoms could be cancer and not cancers. Some patients go to their doctor because of the mass they see in the skin, for example, or under the skin. Their doctor do some work, then they tell them you have cancer. Or patient, older man with symptoms of prostate enlargement, they do blood test. They found that PSA, which is prostatic specific antigen, is elevated. The patient undergo biopsy, and that came back as cancer of the prostate. Patient has been coughing. They do chest x-ray. They found mass in the lung that undergo biopsy, and it came back as cancer. A lady was bleeding, then they do examination. They found mass in the cervix. They do biopsy. It came back as cancer. So how patients react once they know they have cancer? Number one, I'm telling all my patients, do not react, do not feel anything. Of course, you will feel worrying once you hear cancer. But let me assure you, big number of cancers, maybe more than half. As a matter of fact, the majority of early cancer will be cured with excellent results. And for you, number one, you need to know what stage of your cancer, what is the outcome. So once you know you have cancer, don't panic, because many big number of cancer patients are cured today. Technology is advanced now. So once you have cancer, number one, you need to know what stage, and your cancer specialist will tell you all this information. Once you diagnosed of cancer, we do what we call it staging. We want to make sure, is this cancer early or widespread? So we do few investigations, few tests, include X-ray, PET scan, CAT scan, MRI, blood work, and sometimes biopsies, to know exactly what stage you are. You could be stage 1 or 2 or 3 or 4. Also, I need you to know that not necessarily if you are stage 4, that's bad news. It has to do what type of cancer. For example, a patient with lymphoma, stage 4, they could be cured with big chance of success and a good lifestyle, and they live normal. Or patients with thyroid cancer, they could live normal, especially if they are younger in age, and so on. So number one, we need to know what type of cancer. Number two, what stage. Number three, how this patient is treated. What are the treatment options? So patients will go through few stages. Each stage will explore more to pinpoint the outcome and the treatment of such patient. For example, not too long ago, a couple of weeks ago, I saw a patient his PSA was elevated. A biopsy came back as adenocarcinoma of the prostate. I saw the patient. He was so worrying before I tell him anything. Was panicking, worrying, depressed, and so on. After we talked, less than half an hour, he was so relieved, he's so relaxed, and feel way better. Why that? Because he knew that his cancer is early and the chance of cure is very high and the treatment is easy. Once patients know that, they feel well. So once you know you have cancer or you have a test could be cancer, number one, do not panic. Number two, see your specialist, cancer specialist. They sit with you and explain everything to you from A to Z. And that will include work up, blood work, X-ray work, and so on, to know what stage you are. Once you have these elements, you sit with your doctor, cancer specialist. They tell you what are the options of your treatment. Usually there are more than one option, and your doctor need to explore each option in terms of benefit versus side effects. And it is wise that you hear every option from the physician. Do such option. For example, if the option is to do surgery, you need to hear the option from a surgeon. If the option to do chemotherapy, you need to hear the options from the chemotherapy doctor. He will tell you the side effects, the benefits, and so on. If the option is to do radiation treatment, you must sit with a radiation specialist. He will tell you pros and cons of the treatment, the success rate, and so on. So you will be more informed. So usually the options either surgery or radiation or chemotherapy or combination of the above. It's very wise that you sit with the three disciplines if the three are your options. Then you pick what option suits you most. If you don't want surgery, yes, the alternative treatment, for example, for prostate cancer is radiation. If you don't want radiation, the alternative treatment for radiation is surgery, and so on. Most important, you need to know that this treatment will not compromise your cure. Your cure will not be compromised. If you go for radiation or surgery or chemotherapy or combination of the above, the end point here is your cure is not compromised. And once you decide, you go ahead for the treatment, and God willing, the treatment will be smooth, easy, and the outcome is very good. So patients, when they know cancer, they should not panic. They should go for staging, work up, treatment, and God willing will be cured.